So that's me, Tracey Amos. So I've got quite a long job title there, that I'm the Senior Workforce Modernisation Officer at the Health Board. What it really means is I do all the widen access stuff, which I really enjoy. I'm one of the lucky people that really enjoys going to work. I love my job, it's brilliant. And one of the things that I do is obviously the project search and supported interns. This year I've had 22 across 3 sites, and it's like having another 22 grown-up children that I need to look after and worry about. So I'm just going to tell you a little bit about the programmes that we do to help people with barriers to recruitment. On the bottom of that first slide, you could see all the logos there. They're all the partners that we work with, because every site is slightly different. So I just wanted to show the impact of all the different people that are involved with the health board, and we couldn't do any of our work without anybody in those partners. Sorry, thank you. So back in 2017, I think I had about a month to put project search in Bangor. It came to me really fast, and I just moved across to this role. So we rushed at it, and we managed to get started in September. We even got the chief exec gave us his office in Bangor because we had nowhere to be, and we just rushed in and we got started. It took a lot of me knocking on people's doors and wandering around Dustbutty Gwynedd day after day after day. So what we decided to do back then was to look at how we could develop a programme that incorporates everything in the health board to help all different people with a barrier to recruitment, because we'd identified that there was lots of recruitment gaps across all of the health board. I cover the whole health board, so I cover from Wrexham to Bangor. And this is the programme that we have. We're under a banner of Step Into Work. We have supported shared apprenticeships in there, which I'll go on a bit about later, supported internships, adult volunteer programme, and I partner with social care when I do that type of programme. So it means that we're now trying to provide an inclusive workplace and a mechanism for work for all different people with different types of barriers. And the barriers are vast. You know, the barriers can be so many different things. What we always do is put the individual at the heart of everything that I do. So depending on which programme I'm working with, they're always at the heart of everything. And then we develop and we work to their pace and their what fits them, what they like to do. So I need to work really closely with our occupational health team. I need to work closely with, obviously, Access to Work. We quite often use Access to Work, and our supported employment partners. And we couldn't do a lot of our individuals without that job coaching. You wouldn't get the same results, and I can prove that, because obviously I run different programs, because not everybody fits project search or supported interns, and we don't want to leave people without any support. So I do have other programs that I support people with, and a lot of the time our trusted partners, that's Agoriad Cuff or HFT, will step in. Quite often they do us a favour and they'll support someone because it is the best result. Occupational health will help me with reasonable adjustments. We do have policies in the health board, and they'll come back to me and they'll say, right, this person could do with this, and I'll go out of my way to work with the organisation to put those reasonable adjustments into place. And like I say, the partnership is the key. All the different partners that we work with is what makes it work for us. At the moment, across all of my programmes, we're on 400, well, actually, on Friday it was 440 jobs, because I recruited 10 last week. So that's really exciting news that it actually does work. And there's just some pictures there of some of the different people that we bring through. Okay, thank you. So the supported internships and DFM project search. So at the moment, I have 3 sites. So I have a site in Bangor, which is called Supported Internships, with its own set of partners. I have a site in Glenclwyd Hospital, and again, that is project search, and that has different partners. And then I also have a site in Flintshire Community, which is a partnership HFT. can see Julia's here. And we are a host business with Flintshire County Council. So that's in its first year, which hoping to develop year on year on year. And I'm just working on implementation of a site in Wrexham Myler for September 2025 with a very small team, so it might take me a while. I just wanted to put a couple of little stories there from people that are working with us at the moment. So Josh is in Glenclwyd. He's been on rotations as a porter, and on Friday they offered him a job as a bank porter. So I'm busy recruiting him after that meeting on Friday. We met with his mum, and his mum was really, really excited. And then also we've got Jordan. Jordan is from our Flintshire site, and he's at the moment in one of our managed GP practices in Flint, doing extremely well. The feedback is amazing, and I'm already sniffing around them and pushing to try and see what I can do to look for a role for him later on. So we all know that the figure's really low of young adults in Wales that have full-time employment from this group, and I'm really proud to say that we're on 70% of our young adults that come through Project Search or supported interns who have gone on to employment, not all in the health board, some externally, but there are a lot in the health board. Like you've already met Tim. I don't know how I could follow you, Tim, but Tim, I love it when I go onto the sites and I can walk around, and young adults that I meet on day one when we're doing assessment centres who may not interact with me, they may not talk to me, be a bit nervous. And just recently I walked across the car park and heard someone shout, "Tracey!" And it was one of the interns from one of the earlier projects who came running over to chat to me. So I'm always really, really proud. Thank you. We started doing supported shared apprenticeships in the health board, so that is delivered under the Welsh Government Work-Based Learning Programme to support young adults who may not, with a disadvantage, who may not be able to partake in a mainstream apprenticeship. We've got 7 at the moment across the 3 sites, and I'm working on, on Friday we've got 8. We got the go-ahead to recruit in Glenclwyd, Amber, who's going to be a pharmacy supported shared apprentice. And like I say, I'm trying to work on Jordan for for Flintshire. So this is Nell in the corner. She's in YG. She's been doing her supported shared apprentice as a healthcare assistant, patient care, personal care. She's doing extremely well. She's coming up on about 9 or 10 months now. And then we've got Dylan here. Dylan is in Glenclwyd Hospital, and he's a porter laundry apprenticeship, supported shared apprentice, and he's amazing. He pushes his big cages around 10 till 2 every day, collecting all the linen from the wards and then delivering new linen. And then I think that's everyone. We've just got some comments. You'll probably get this presentation after, is that right, if they want it? Yeah, okay, thank you. And then just to talk about my other programme, because some of you may be interested in that. So obviously, Project Search and supported interns, we are in recruitment at the moment for September. So if anybody's interested in that, you can always let me know for the 3 sites. This programme I run bi-monthly, and it's for anyone with a barrier to recruitment, and those barriers can be anything from confidence, mental health issue, disability, just being out of their luck and out of work. Quite often whole families don't work. And I do that bi-monthly munching circles on Teams, 10 o'clock on a Wednesday morning, and I usually have a good 50 people on each of those, sometimes more. We then front load them, so I do all their clearance, ID, DBSs, occupational health clearance. They do all of our mandatory training, which I'm not going to lie is a bit painful. There's a lot of it. I have to do it myself, over 20 of them. And they do that before they even go anywhere. If they want to do healthcare assistant, if they want to do porter, they have to do the training specific for that role. So we book them onto that training. And then they do a 6-week unpaid placement at a minimum of 16 hours per week. And I've tested that over the years, and that's what gets us the jobs. Because my view is when I speak to managers and I get the placements, I say, why wouldn't you want to recruit them? You know, they've committed to us, they've done all this work, they've been to you for 6 weeks unpaid, why wouldn't you? So because of that, I've got a HR protocol that I got the board to sign off that says that anyone who comes on any of my programmes, if they do a good job, so they've got to do a good job, which it's very rare they don't, then I've got the gift to recruit them directly to our generic banks. So that's why our numbers are so good. I think I've got about 25 out at the moment, and I'm in recruitment of about another 20. So it's constantly turning those numbers. And this is just some quotes there of some of our managers who have placements from me and how good it is and how well it works. And then this is Angarad, single mum who wanted to go back into the workplace. She came through the programme and we put them at the centre, and sometimes we go a bit slower if they need a bit more time to do the relearning. Some do it really quick. She went into A&E on her placement, which we've never done A&E before, and now she works permanently in A&E. And she's just changed her life. It's amazing. So that's my other programme. The mentoring circles do things like about the health board, about me. I partner with social care because we're all pinching from the same pot. I want you to work for me, they want you to work for them, so let's work together. So sometimes we place in one or the other, and we do about that. We then do how to apply for an NHS job, because again, I'm not going to lie, it's very hard. And I go through step by step how to get shortlisted. Feedback from managers now is, oh, I can tell they're one of yours, they do a good application, they always get shortlisted. And the HR protocol says you can have a guaranteed interview if you meet the essential criteria on the back of that. We do round robin mock interviews, and then I deliver the full health board induction so that like any other member of staff would. So again, really good programme. Thank you. Is that it? Did I just do 5 slides? So that's it. Thank you very much.